Hi, everyone. I am very pleased that you've stopped by to watch this video about Bowen Family Systems Couple Coaching. If you are one of my graduate students, then you are, of course, required to watch this video. If you are not one of my graduate students, then I'm even more impressed that you have decided to stop by. If that is the case, please leave a comment down below. I'd love to hear about why you're watching this, and if there are any other theories that you're interested in learning more about. This is the first of a series of videos that I'll be putting out about many of the most common relationship theories that are sort of out there. Just a little bit about me. I am Dr. Doug, and I am licensed in Georgia and Hawaii as a clinical psychologist, and I'm also board certified as a couple and family psychologist. I also hold a PsyPAC designation, which allows me to work with clients in most states across the country. I have a private practice where I work with individuals, couples, and groups, and am also a professor for a couple of different graduate programs for therapists and psychologists. Now, let's just start out with a brief note on semantics. The theories that I'm going to be covering in this series of videos, you will often hear referred to as marital therapy or couples counseling. And for the purpose of these lectures, I will be referring to them as relationship therapy. And also, because not all relationships are spousal, I will be referring to folks as partners rather than spouses. My hope is not that you will just go out and start doing relationship therapy as a result of watching these videos. As I mentioned, these are sort of very high level and very big picture. And if you are in one of my classes, then we, of course, go into more of the details of what goes into relationship therapy and some more of the theories that go into that, as well as the practice of it. So just for both of us to understand that the outcome of these videos is really just for you to have a better cognitive understanding rather than having clinical prowess just as a result of watching these videos. Here's the agenda for what we will be talking about today. And this agenda will be common across all of the different theories that I'll be covering in this series of videos. To introduce Bowen theory, here are just 3 broad stroke bullets about this theory. So keeping in mind that the theory comes from Bowen's observations that largely occurred during the 1950s. And he created family systems theory. And then for the purpose of today's lecture, the information that he created about family systems was then sort of extrapolated into work with smaller relationship systems. One of the biggest themes out of Bowen theory is that he saw relationships as being the same as systems in nature or anywhere else that you might see a system. So a system is a subset of subsystems. I know, that's brilliant. And in any system, in order for there to be balance and harmony and for things to be functional and running well, there has to be balance among those subsystems. So think about a town. Let's say it's a smaller type of town, and you have all of these subsystems in that town. So that could be the people, the organizations, the government, the buildings, the infrastructure, the utilities. So all of these are subsystems within that larger town system. And if any of those subsystems collapses, for example, let's say that street lights all stop working in the entire town. So you have one subsystem that fails and it deharmonizes the larger system, and all of the other subsystems necessarily will feel some level of impact, some more than others. Obviously, people who drive would be more affected by stoplights being out. However, they might be in a bad mood because of the stoplights and traffic being backed up. And so then they go home and then their families are affected. And then those family members go to the grocery store and it's just sort of dominoes. So there's these ripple effect for a subsystem failing. Now, over time, let's say those stoplights were never repaired for whatever reason. The system tries to get back into balance, and so adaptations will form. So let's say in this sample town that the folks in the town, instead of relying on stoplights, they devise this system where they use hand signals with each other. So you come to a four-way stop, everyone stops, and people will signal whether they're going straight or turning. And then based on that, people will decide who can go first, and then they'll take turns at any given intersection. So that's an adaptation that was created in order to reset the balance in that system. So that is great. As long as you stay in that town, then it's a wonderful practice. And if it's working, it's working. The problem happens, as you could probably guess, the problem happens if you happen to leave that town. And maybe any town that isn't willing to fix their stoplights for long term, you might see why people would exodus from that town. Anyway, so if you leave that town and you go to any other town in the US where there are actually stoplights, and you have not grown up with stoplights or you have forgotten how to use stoplights, and so you come to an intersection, you do some kind of hand signal, and then you go on a red light, and this will cause problems because the adaptation that you created is no longer helpful or appropriate in the new system that you find yourself in. So what does this mean about relationships and families and couples and your romantic partnerships? So this means that, when you were a kid and living with your family of origin, your nuclear family, that it made sense that you created an adaptation for yourself where every single night you would demand and need to know that both of your parents were in bed before you would go to sleep. And it's because you learned that if that wasn't the case, if both your parents weren't in bed, there was a pretty good chance that that meant that one or both of them was drinking alcohol again. And that could mean that they would be gone for a couple of days or a couple of weeks. And you would be the one in charge of the household, in charge of your siblings, making sure everybody eats and is taken care of. So you are heavily invested in knowing that your parents are there or not there so that you can prepare yourself for what will happen the next day. In that system of your nuclear family, that adaptation makes total sense. It may be unfair, it may be not great for any kid. However, you created an adaptation that helped you to survive and function, and it worked for you for that time that you were living there. Now, fast forward a bunch of years, here you are in your romantic relationship, and you are distrusting of your partner. They are not home on time, or you don't know where they are 24 hours a day. And you are demanding, you're tracking them, you're following them. You are getting really angry with them for not being in greater communication with you. So in that system, that adaptation that you had formally created is no longer helpful and probably no longer appropriate. And so this is a case of a system, you were in this previous system, you balanced it, you move over to another system. The thing that you did to balance the old system is now unbalancing the new system. And so this is sort of what Bowen was seeing, was that things that are happening out in the environment seem to be mimicking themselves in these close, intimate relationships. And as we go through this lecture, you'll see more details about what exactly that means. The beliefs that guide Bowen theory can be sort of summarized in these 3 points: that there are unresolved issues from your old family systems that are, for some reason, causing imbalance in the current system, in your current relationships. And Bowen would say that that imbalance is happening in one of 3 subsystems, that you have the intellectual subsystem, the emotional subsystem, which are both pretty much what they sound like, and then the feeling subsystem, which is a bridge between the emotional and the intellectual. And Bowen said that if these 3 were not in harmony with each other, that is when you start to have a breakdown and these imbalances that occur in the emotional system, in the system of those relationships. Bowen also said that if you are in an intimate relationship with another person, that it is highly likely that you have similar levels of differentiation. Now, these clients will come in to see us, and they may look on the surface as if they have differing levels of differentiation. However, it is important for us to hold on to our systemic perspective and to be looking at what is going on below the surface. Because what may look like 2 different levels of differentiation may instead be that one person has borrowed a sense of self from the other. And so as they have borrowed that sense of self from the other person, that has made them look more differentiated and has made the other person look less differentiated. So sort of this is the common pursuer-withdrawer pattern that you'll see. Sorry, that should have been flipped. This person is the withdrawer and this person is the pursuer. This person looks like they are so dependent and sort of needing the other person. And this person looks like they don't need the other person. However, it is just 2 different faces of the same level of differentiation. And you will learn more about that not only in Bowen theory, but sort of as we go along with the other videos also. The other belief that Bowen had was that clients can find the solutions themselves. They don't need us to find or create solutions for them. And so you will notice in Bowen theory that at no point do you ever go into solution searching or problem solving. And you are merely helping the clients to increase their differentiation, to increase their insight, and to increase their ability to adapt to new situations. And Bowen said, if we equip clients with those 3 things, they themselves can then move forward without us and find solutions as they go along, because they will now have this new perspective, this new way of thinking, this new way of being that allows them to see things differently and in a healthier way. The third belief is that the most important qualities that a therapist can have who is a Bowen therapist is neutrality and differentiation themselves. So the neutrality you'll sort of hear as an ongoing theme in Bowen therapy. It's very important for the therapist to not be taking sides and to be able to see the picture, see the system from a neutral perspective. And the way that we can do that is if we are continually working on our own differentiation. If we are not working on our differentiation, it will be very, very difficult to maintain neutrality when we're working with these relationships. So I just realized that I should probably shift over to this direction so that the PowerPoint can actually show in this space. You can tell that this is the first video of the series, and maybe someday I'll look back on this one and really crack myself up. So this next slide, it's just another note about differentiation. I think that for graduate students, for therapists, psychologists, we all sort of have our own idea about what the term differentiation means. This particular quote I just found to be so appropriate, so accurate, and I think that it just provided a really nice perspective on what differentiation actually is. In terms of the process, if you are conducting Bowen therapy with a relationship client, these are sort of 5 of the main points that you would be keeping in mind in that type of treatment. So this first one, that clients prepare agenda. Clients are in charge of what happens in the sessions and the frequency of those sessions and when treatment will terminate. So Bowen's perspective was that clients can figure this stuff out on their own, and we want them to already be adopting a mindset of self-empowerment and of knowing what's best for themselves, rather than us being the ones who determine that for them. So that preparing of the agenda is necessary in Bowen therapy. And that would be something that you would explain to clients from the very beginning, whether it's in that initial phone call or in that initial session, of just making sure that the clients understand that that is something that they need to be thinking about before session, because you will ask them right at the beginning of session, what are the agenda items that you're bringing? And you as the provider can, of course, contribute your own ideas to that of, what do you think about adding this? Or we had been talking about this last week. Did you want to incorporate that also into the agenda? And so you can, of course, have those suggestions, and the client is the one who would have the final say in Bowen therapy. The second point about keeping treatment as brief as possible, this is something that is definitely attached to Bowen therapy, that we want clients to get what they need from us and nothing more, and for them to have the tools that they need in order for them to help themselves on a long-term basis. So this third point about can see clients separately. This should not be a total surprise to any of you folks, especially if you are in the field, that if there's a theory that is focused on differentiation of the individual, that it makes sense that you can do individual work in the context of relationship therapy. And the reason for that is that with Bowen theory, what is necessary is for clients to attain differentiation and to be building on that differentiation. So the increase in differentiation in that person would then leak over into the relationship. And similar to what I was talking about previously about systems doing what they need in order to right themselves, if the one partner is more differentiated, then the other partner will respond in some way so that there can be, again, balance in the system. And so whether we're seeing them together or individually, either way would work in terms of Bowen theory. And one last note about that in terms of only seeing one person, if you have the choice of only seeing one, then Bowen would say that it would be better to see the person who is more motivated, because that person would then be more interested in sort of grabbing the reins and doing the things that they need to do in order to improve themselves, in order to enact change for themselves and the relationship. And so you would have a higher likelihood of seeing change and improvement with that person. The fourth is that Bowen therapy is more cognitive versus emotional. In session, you won't really have people where there's emotions running high. People aren't arguing in a Bowen session. We're not encouraging people to sort of let loose. And, this type of therapy is one in which during session, we are talking rationally and we are taking turns and sort of thinking about things rather than letting our feelings cause us to react. And that reactivity is something that we are actually trying to help them grow out of and learn how to not react like that. And the last point here is about exploring the how, what, when, and where, but we're not really exploring the why. And the reason for that is that Bowen says that when you ask somebody a question, a why question, the answer that you invariably get is a subjective answer. And we don't want subjective answers. We want objective information that we can use in therapy in order to help these clients reach their goals. So these points of focus for Bowen therapy are likely not a surprise at this point because I've already sort of said a lot of these words multiple times already. However, this is a really helpful slide to just keep around if you are practicing Bowen therapy, because if at any point during session you are lost or find yourself drifting into another type of theory, you can sort of glance at this slide and realize, oh, am I focusing on one of these four things? If not, I have probably sort of drifted away from Bowen and have gone into some other theory. So when we're looking at family systems concepts in Bowen therapy, we are looking at 7 different family systems concepts. So one is the differentiation of self. And when we're talking about that, we're talking about differentiation of the client as well as differentiation of the therapist, as I've already mentioned. Another is emotional triangle. So emotional triangles are when you bring in a third component to your relationship. And by third, it doesn't necessarily mean the number 3 third. So you could be in a relationship that is not a dyad. Let's say you have 3 or more partners. And if you bring in a third element, that is still an emotional triangle, even though there's more than 3 elements. So emotional triangles, I often think of this in terms of a stool. So if you have a 2-legged stool, you can sit on a 2-legged stool. I don't know if any of you have ever tried that. It is quite precarious. And you have to be very careful and thoughtful when you're sitting on a 2-legged stool. So it is possible you have these two legs that are a foundation. You have something to sit on, but it requires constant work on your part. If you add in a third leg, if you've created a triangle, then that stabilizes the entire system. Now you can lift your legs up, you can kick back literally, and you don't have to worry about falling over. Of course, unless there's no back, then of course you could fall over. But let's say you are totally stable and the stool is very firmly on the ground because it has that third leg. Similarly, in interactions, you may have noticed this, that having a conversation with just one other person, things can feel much more potentially awkward or emotionally loaded than if there is a third element. So you and I are sitting there at the kitchen table and you've said something that has irritated me and I am just fuming inside and I'm about to lash out to you, and you turn and say, "Oh, look at the dog. He's doing something really cute." Or, "Oh, the baby looks like he wants to eat. We probably should take care of him." So you've somehow, one of you has brought in this third element that now you can focus on instead of focusing on what's going on between the two of us. I mean, if you have a child at home, that emotional triangle could be there for 18, 20, 30 years. Or if you have a dog, similarly, could be 10, 15, 20 years. And there is always the possibility of being able to triangulate something in. It could be you're triangulating in the postal carrier or the paint that needs to be fixed in the bathroom. So whenever we bring in that third element, it can reduce the anxiety between us, which is helpful and much more comfortable, of course, but not helpful in terms of it leaves things unresolved. So if there are emotional triangles that occurred in your older family system, then that is likely going to be impacting your current relationship. The next family systems concept is the nuclear family emotional system. So that is the system that was happening with your nuclear family when you were younger. And if there are any unresolved attachment issues that were playing out back then, it is likely that those will be playing out in some way in your current intimate relationships. Another family systems concept is projection, which is also a psychodynamic concept, and we'll actually be talking about that when we talk about psychodynamic. However, in this case, it means the same thing, where however way I'm feeling about myself or however way I'm feeling about our relationship, I then project onto another person. And oftentimes that is the child in the house. And so that child will end up getting projected onto. So you might be able to tell that this is a form of emotional triangulation. And so if you were that child who was projected onto, then you may have grown up thinking that you are a problem, that you caused issues in your parents' relationships, that maybe you were the cause of your parents' depression, or that you are incapable of being in intimate relationships. So there's all these sort of possible ramifications of having been projected onto as a child that, of course, are then impacting your current relationship. The next family systems concept is emotional cutoff. And what I have found a lot of times with clients is that they may wrongly believe that they have exercised differentiation by emotionally cutting off from their family of origin. And of course, that reactivity is definitely a sign of lower level of differentiation. So highly differentiated would mean that I am not reactive to these people. But if I have done something as drastic as intentionally cut off, then that is indicating that there is an unresolved issue there. And multi-generational transmission is another family systems concept. And this is merely saying sort of what I've been indicating, that you can have these unresolved attachment issues, these unresolved imbalances in these family systems, these sort of adaptations that have been passed down through the generations. And each generation, it may take on a different face. It may look a little bit different, but in each case, it continues to still be this multi-generational transmission of these imbalances. And finally, the last family systems concept that we're going to be talking about is sibling position. And by sibling position, I mean birth order of you in relative to your siblings. And what Bowen said was that if a person behaves in a way that is very stereotypically associated with that birth order, then that can be an indication of a lower level of differentiation. So the upshot of this is that when we're looking at what is the focus of Bowenian therapy, we're sort of looking at these four things, and we're making sure that we are really paying attention to processes and imbalances rather than looking for solutions or examining a specific problem or even examining the relationship itself. So this is sort of a very important point for you to keep in mind if you really want to have a understanding of how Bowenian therapy works. So the role of the therapist is basically these three roles: that you are an expert position. So the assumption is that you know a lot. And that second role of coach is saying that we are sort of not getting hung up on pathology. So we're not thinking about diagnoses or what's wrong with people, or what are the problems that need to be fixed, but rather what are the opportunities in this situation, and how can we take the strengths and qualities that you already have and use those to your benefit. And about the educator role, of course, the Bowenian therapist is constantly educating the clients on these family systems concepts, pointing out when they are recognizing different patterns, different processes, and sort of really taking that role to heart when you are working with relationships. So in terms of interventions, we're looking at psychoeducation, identifying family systems, patterns, building differentiation, skills to decrease reactivity. So when we're looking at building differentiation skills, what that means is that we are helping them to be less reactive, more rational, more cognitive, so that they have some space to look at situations more rationally and neutrally. And rather than, I want to act this way because I'm just so angry, but instead thinking like, okay, if I act that way, that will actually make the situation worse. So let me take a step back, look at what's going on. So I'm going to come back in and I'm going to approach my partner in a way that is more open and vulnerable and welcoming rather than pushing them away. And so that's sort of part of it. The other part is that we are really encouraging them to take responsibility just for themselves rather than taking responsibility for the other person. This is one of the key features of differentiation, is that I am not taking responsibility for you. Oh, that's my straw. Sorry. One of the key features is I'm not taking responsibility for you. I'm not taking care of you unless you would like me to help you out. And I am not demanding that you change. Your state is not impacting me, but instead I'm saying that I'm responsible for myself. I'm the one who's ultimately the one who impacts myself the greatest. And I have choices that I can make regarding how I exist in this world. For the skills to decrease reactivity, what we're looking at is coping tools to help decrease your anxiety, helping you to move away from blaming the other person and instead to trying to work together, be more collaborative in order to find solutions with each other, the partners. And part of these interventions is something called the Bowen 3-step. And what this strategy is you will work with one client and they will make a decision regarding something that they want to do, some kind of solution that they have come up with for themselves. Again, we are not problem solving with the client, but instead, this is something that they came up with based on their knowledge and based on the work that they've done in treatment. So they will come up with some kind of solution to a problem. That's step one. Step two is that we ask them to hypothesize about what do you think that your partner will do to try to change your behavior back to what it used to be. We call it a change back behavior. And so the client will think about what that possible thing could be. And then the third step is, okay, if that does happen, what will you do? How will your response be? And that is the Bowen 3-step. So you may be asking yourself, what is this change back behavior about? Why does that happen? And it is because of how systems operate. So you change something in the system, and the system will try to balance itself out. The easiest way for a system to balance itself out is to demand that change reverse itself. So if we look back to that initial example about stoplights all breaking down in a town, the easiest solution and what everybody in the town wants is just fix all the stoplights. Take that change back, and then we can just go back to being the way that we always were. And so we may do various change back behaviors. Maybe we're writing letters to the mayor. We're complaining to the utility company or the streetlight company. Whatever it is that we're doing all these sort of change back behaviors. And that is the system's attempt to right itself. And in your relationship, it is no different. So you change something and your partner will do something in order to try to balance that system back out, whether it is demanding that you reverse that change or they do some kind of change themselves. Who knows? So one example might be that if you, let's say you are doing the Bowen 3-step with me, and I've decided, okay, one of the solutions that I've created for our relationship, for my part, is that when I come home from work, instead of immediately just complaining about all of the stuff that happened at work, because that creates sort of a bad mood, a bad environment for us for the rest of the night, and is definitely not helping our relationship. So instead of doing that, when I come home, I'm instead going to look my partner in the eyes, give them a hug and maybe a kiss, ask them how their day was, and we're just going to talk about that for a few minutes. And then we will talk about dinner or whatever else it is that is sort of most pertinent for the household. And then maybe later on, I'll mention how work went, but maybe not, unless something sort of really unusual happened. And the potential change back behavior that my partner might do would be that as soon as I walk in the door, they start complaining about their job and what happened that day at work. Or they ask me, oh, how is that jerk that you work with? Or what kind of bad stuff happened today? So they are sort of doing this change back behavior that will reignite the old pattern. So what I'm planning right now, as you and I are talking, is that my third step would be that I will calmly remind my partner, hey, remember I had this plan of not complaining about work when I get home, and for us to instead talk about other things so that we can set a better mood for ourselves going into the night. Are you still good with that plan? Does it still work with you? And my partner will likely say yes. And thank you for that reminder. And then we can go on to the new plan. And so that is great. I've come up with a solution, talked about the possible barrier, talked about how I would recover from that barrier. So these goals of Bowen therapy, I've sort of already mentioned these, right? So these 3 goals, and differentiation takes a long time to build. And the growth in differentiation is usually a slow process. And as I mentioned before, can take a lifetime. You could be working on differentiation for the rest of your life. So in the course of our sessions with these clients, there's no way that they are going to become these 100% differentiated people just in treatment. So our expectations have to be sort of more realistic. And instead, we're really focusing on insight and adaptation, and the differentiation as that grows, that will feed into the insight and adaptation. And as the insight and adaptation grow, that will feed into the differentiation. And they will sort of all help each other to continue developing long after therapy is done. This is just what the folks are doing on their own after they have finished working with us. So here I am talking about some of the typical things that a Bowen therapist might be saying to clients. So as you look over these questions, sort of ask yourself, what is the insight that this is sort of going after? Or how is this going to help improve differentiation? Or how is this helping the person with adaptation? So pretty much, I think almost all of these questions impact all 3 of those in some way. And maybe some of them are a little bit more, some of them are a little bit less. So my hoped for takeaways for you from this lecture are that insight, differentiation, and adaptation are the goals, not relationship improvement. So when these partners come to you, when these clients come to you, that you are not digging into the relationship, you are not, wanting to know all of these details about the relationship, because your focus is not the relationship. Your focus is on differentiation, insight, adaptation of the individuals. And that will then leak over and benefit the greater system, which is the relationship. So the relationship improving is a secondary benefit of this type of therapy. The primary benefit is the growth of the individual. The second takeaway, that it can look a little bit more like individual therapy than relationship therapy. So in other types of relationship therapy, you're going to be doing a lot of talking about the relationship. Oh, how did you feel when so-and-so said that? What is what are the things that are going on between the two of you? But instead, it's a lot of, I'm talking to you individually, and then I'm talking to you individually. And then you are sort of drawing the connections between, what does that actually mean? The third is that therapist is a neutral coach, and that you are not taking sides, and you are so wonderfully differentiated that you are not being reactive to what's going on in session. You're not taking things personally. Your own family of origin issues are not being triggered, or if they are not impacting the relationship. And you are neutral enough that you can sort of see the systems that are happening in front of you and how those are all sort of interacting. And that sort of takes us into the last takeaway, that you are really focusing on system imbalances. So here's the system, here are the subsystems, where are the imbalances? What's going on at the intellectual subsystem, the emotional subsystem, the feeling subsystem? Where are there issues where things have destabilized and have not righted themselves yet? And sort of that is what we need to be focusing on once we identify that. So I really appreciate that you were interested in Bowen therapy and specifically hearing me talk about Bowen therapy. And I hope that this was helpful and interesting for you. And this is sort of my final words. This will be at the end of every presentation, that instead of learning how to be perfect, you're learning how to be in relationship with your imperfections so that the two of you can work in harmony. And this is not just a message for our clients. This is a message for any of you, especially if you're a student or if you're just trying to improve your skills as a therapist, that again, the goal is not for you to be a perfect therapist or a perfect human being, but for you to really understand what's going on for yourself so that you can integrate that and be in harmony with those different subsystems within yourself. So I would greatly appreciate it if you would like this show, if you did like it, and if you would like to be alerted to the future videos that I'm going to be putting out, then definitely please subscribe. That would be really, really lovely, and I would greatly appreciate it. You might also be interested in my other channel, Creative Psychology with Dr. Doug, where I do not do lectures, but instead am talking about just a wide variety of psych type of topics. And that will also be building, and I'll be coming out with new videos all the time, and would love to hear any requests or any ideas that you might have. So feel free to comment down below and let me know what you thought of this, and if there are any specific theories that you want to make sure that I cover specifically for relationship therapy. So until the next time I see you, I hope that you and your imperfections can continue to develop a wonderfully harmonious relationship.